You drop 10 pounds fast. Your clothes fit, and everyone claps. Then your sleep tanks, your workouts feel dead, your heart starts doing weird flutters, and you tell yourself it is just keto flu. That is the trap. Keto can work, but it can also push the wrong body or the wrong medication setup into a real problem. Your body does not whisper forever. It escalates. If you learn the red flags early, you can stop before you pay for quick progress with a long setback. Moving to slide 2. First, a safety rule. Keto is not a personality test. It is a metabolic stressor, and your medical situation changes the risk fast. If you take blood pressure meds or diuretics, cutting carbs can make you dump water and sodium quickly, and your usual dose can suddenly be too strong. If you use insulin or diabetes meds that can cause lows, your carb intake drops, but the medication may not. That mismatch is where people get into trouble. If you have kidney disease, heart failure, a history of eating disorders, gout, pancreatitis, or you are underweight, do not self-experiment. If you are pregnant or breastfeeding, do not run strict keto. Pregnancy already raises ketone production, and prolonged high ketones are not a casual wellness goal. Kids and teens need clinician oversight, because growth, energy needs, and nutrient sufficiency are different. Your rule is simple. If you are unsure, ask a clinician or pharmacist before you start, and again anytime symptoms change. That one step prevents the most dangerous version of keto mistakes. Moving to slide 3. Diabetes is the danger zone because keto changes fuel and medication needs at the same time. If you have type 1 diabetes, do not do keto without close supervision. You can develop ketoacidosis even if your glucose is not high, especially if insulin is reduced too aggressively. If you take an SGLT2 inhibitor like empagliflozin, dapagliflozin, or canagliflozin, be extra careful. These drugs can raise the risk of euglycemic diabetic ketoacidosis, where blood sugar looks fine, but ketones climb and the blood becomes acidic. That is not something you fix with willpower or a nap. What should make you act? New nausea or vomiting, stomach pain, deep or rapid breathing, unusual fatigue, confusion, or a fruity breath smell. If you have diabetes and you feel sick on keto, check ketones if you can. If ketones are high or symptoms are escalating, seek urgent care. Ketoacidosis is a medical emergency, and the right move is getting treated early. Moving to slide 4. Dizziness is not always harmless. If standing up makes you spin, your heart races out of nowhere, you see black spots, or you feel like you might faint, take that seriously. Early keto can increase salt and water loss, which can drop blood pressure. Blood pressure meds, diuretics, and dehydration make that drop worse. Do not tough it out. Stabilize, reassess, and treat the signal like it matters. Moving to slide 5. Now the ones people dismiss until they get scary. Palpitations and cramps. If your heart feels like it is fluttering, skipping, or thumping in your chest, do not assume it is anxiety. If night leg cramps suddenly spike, your grip feels weak, or your limbs feel heavy, think electrolytes first. Keto often increases sodium loss early on. When sodium drops, your body can also waste more potassium and magnesium. Low potassium can trigger palpitations, muscle weakness, and in severe cases, dangerous rhythm problems. Low magnesium can worsen cramps and make palpitations more likely. What you do? If you have mild symptoms and no heart disease, start by correcting basics the same day. Hydrate. Add sodium with salted food or broth. Prioritize potassium-rich whole foods that fit your plan, like avocado, leafy greens, and yogurt if you tolerate it. Consider magnesium glycinate or citrate if cramps persist, but avoid megadoses. What you do not do. Do not take potassium pills casually, especially if you have kidney disease or take ACE inhibitors, ARBs, or spironolactone. If palpitations come with chest pain, shortness of breath, fainting, or they are new and persistent, get urgent medical help. Your body is not being dramatic. It is sending a hard stop signal. Gallbladder issues are another one people miss. Moving to slide 6. Gallbladder trouble usually shows up as a pattern, not a random twinge.
The classic signal is pain or tight pressure on the right upper side of your belly, sometimes creeping toward the center.
Pay attention to timing. If it reliably flares 1 to 3 hours after a fatty meal, that matters. The gallbladder squeezes hardest when you eat more fat, so a blocked or irritated system often complains right then. Another tell is pain that seems to live under your right shoulder blade, or a dull ache in the back that you cannot stretch away. Nausea that lingers, especially when the pain is present, is also common. Some people notice burping, fullness, or feeling sick after meals that used to be fine. Rapid weight loss raises risk because bile can become more concentrated and stones can form more easily when your body is mobilizing lots of fat. If these symptoms are new, frequent, or intense, do not try to push through by forcing more fat. Stable meals, not extremes, keep your digestion from becoming the next bottleneck in a system that is already under load, including the organs that filter your blood every minute. Moving to slide 7. Your kidneys need extra respect if you are changing carbs, salt, or protein. Dehydration concentrates urine, and that can raise uric acid and increase stone risk in some people. If you already have kidney disease, do not wing it. Get individualized guidance, and treat certain signs as urgent, not optional. Sharp flank or back pain, pain that comes in waves, fever, or any blood in the urine. When filtration is under pressure, small problems can escalate fast, and bowel sluggishness can follow right behind. Moving to slide 8. If you are going days without a bowel movement, or you are passing hard, dry stools with straining, fix that before you push carbs lower. Constipation is not just uncomfortable. It can increase bloating, make your appetite signals chaotic, and make low carb feel like it is the problem, when it is really hydration, fiber, and routine. Start with the basics you can control today. Drink enough that your urine is pale yellow most of the day. If you add electrolytes, make sure you are not using them as a substitute for water. Then build fiber slowly. If you jump from very low fiber to very high fiber overnight, bloating can worsen. Add one fiber upgrade at a time for 3 to 4 days, then reassess. Use foods that are easy to execute: chia or ground flax mixed into yogurt, berries, avocado, legumes if you tolerate them, or a psyllium supplement with a full glass of water. Also look at what changed. Many low-carb switches cut fruit, whole grains, and beans all at once, while increasing cheese and dried meats, which can slow stool for some people. If you are still constipated despite water, gradual fiber, and daily movement, do not ignore it. Your body is telling you the plan needs adjustment before you restrict further, especially if your energy and temperature are also starting to drift. Moving to slide 9. If you feel cold all the time, your energy is flat, hair shedding is increasing, and workouts suddenly feel impossible, zoom out. This can happen when calories are too low for too long, and cutting carbs can compound it by making it easier to undereat without noticing. Do not self-diagnose thyroid disease from symptoms alone, but do take the cluster seriously. Track your intake for a week and confirm you are not accidentally running a large deficit. Bring calories up to a sustainable level, prioritize protein, and keep carbs in a range that supports training and recovery. If symptoms persist, ask your clinician about checking thyroid labs and iron status, since low iron can mimic a lot of the same fatigue. Your goal is not to tough it out. It is to create a plan your body can run without constantly tapping the brakes. Moving to slide 10. One of the fastest ways to spot a mismatch is your sleep and mood. If insomnia starts soon after you cut carbs, or you feel wired at night, then exhausted during the day, take it as feedback. Irritability ramping up, feeling more anxious, or having sharper stress responses can happen when overall stress load rises, including from underfueling, dehydration, or aggressive training on too little recovery. Try a simple reset. Stop chasing the lowest carb number. Anchor dinner with protein, include a portion of carbs if sleep is suffering, and avoid stacking stimulants on top of fatigue. Keep sodium and fluids steady, and do not train hard every day while you are adapting. If your sleep is breaking and your mood is sliding, your plan is not working, no matter what the scale says. A sustainable approach should make you calmer and more resilient, not more fragile, and your hormones will usually tell that story first. Moving to slide 11. If your cycle starts drifting, take it seriously. Irregular periods, longer gaps, or a period that disappears entirely can be your body signaling low energy availability, not good discipline. Add in a sharp drop in libido, feeling colder, sleep getting lighter, or workouts that used to feel easy suddenly taking more out of you. Recovery slows, soreness lingers, and little aches turn into tendon flare-ups or stress reactions because your tissues are not getting enough fuel to repair. If you are training hard and eating low-carb, do not treat these clues as background noise. Track your cycle, track performance, and treat missing cycles as a health red flag, not a badge. Your hormones are giving you a deadline, not a challenge. Moving to slide 12. Ketogenic eating can look clean on paper and still become psychologically dangerous. Watch for the moment structure turns into rules you cannot bend. You stop eating when you are hungry because it is not time, not allowed, or not keto enough. You start fearing normal foods like fruit, oats, bread, or a meal cooked by someone else, even when you want to join in. Then the pressure builds. Restriction all day, then a binge at night, followed by guilt, more rules, and a tighter plan tomorrow. That loop is not a willpower problem. It is a predictable response to underfueling and rigidity. Notice how the scale controls your mood. One number decides if you are good or bad, and that emotion spills into work, relationships, and training. That is a signal to install guardrails. Set minimum fuel targets, especially around workouts. Plan flexibility on purpose, like one non-tracked meal each week, and practice adding back one feared food in a measured way. If you are hiding food, lying about intake, or losing control around eating, bring in professional support early. A diet should serve your life, not shrink it. Moving to slide 13. Here is a smarter off-ramp. Stop chasing deeper ketones as a marker of worth. Pick one goal at a time, like performance, body composition, blood sugar, or mental clarity, and align your plan to that single priority. Use data, not pride. Track sleep, training output, mood, and cycle health, and adjust carbs or total calories when those trend the wrong way. If red flags are stacking up, escalate care with a clinician and a qualified nutrition professional. Subscribe for more evidence-based nutrition without the drama. Comment your biggest red flag. This content is for education only and is not medical advice. If you have symptoms or an eating concern, talk with a qualified healthcare professional. Insulin drives the system. Understand it.